slide that says objectives.
Yep.
Okay.
That sounds great. Super. Well, I apologize we're having so much difficulty. As you know, the purpose of the presentation today was to present to you what the board's perspectives are on the COVID-19 emergency and hopefully explain in enough detail that the listeners understand where the board's coming from in terms of the guidance that it's providing. Towards the end, I would like to just touch briefly on the questions that are coming into the board and then hopefully open this up to questions from all of you. Next slide, please. Okay. There we go. This was yesterday's headline, and I think we all have reached the point now where we're taking the pandemic very seriously and realize that it's going to touch so many of the people we love and millions more. We're so fortunate to be in a country that has some infrastructure. I tremble when I think of the horrors that are going to be happening in the third world. Next slide. Nicole, can you go to the next slide, please?
I did, Dr. Wilson.
Okay, it didn't change on mine.
Okay, so we're on the one that's the mission of the Board of Veterinary Medicine.
There we go. Now I see it. Thank you.
Yeah, your internet is very slow.
That's okay. One of the perspectives that I think is very important for the veterinarians that are listening is to understand the difference between the roles of the MVMA, Minnesota Veterinary Medical Association, Minnesota Department of Health, and MVMA, of course. And so the Board of Veterinary Medicine, our mission is to promote, preserve, and protect the health, safety, and welfare of the public. And originally, it didn't have the animals in this mission statement. So from the legislative standpoint, our primary mission is the public. Next. It hasn't changed
the
yet.
veterinary's oath up now. Are you seeing the veterinary's oath, Dr. Wilson?
Yeah.
Oh, okay.
I did warn you my internet was slow.
Yes.
All right, there it is. For brevity's sake, we all remember that glorious day when we took our oath. And I just wanted to remind you that it includes the promotion of public health. We can go to the next slide.
Okay.
All right, so we've been fortunate to have the Minnesota Department of Health providing us with very timely updates. And I just wanted to point out, in case you weren't following, that the majority of our Minnesota cases now are coming from travel to another state without a known exposure and the community transmission. So these are the numbers for yesterday. Since yesterday, there's been an increase of 53 confirmed positive cases and another death. And I think for me, it's important to see the growing total of cases, but also heartening to see that there haven't been that many increases in new ones. So if we go to the next slide, please, Nicole.
Yes.
When Dr. Ireland presented to you last week, she had so many good pieces of information. And one of the ones that I have really enjoyed looking at is this website, 91DVIC. And what this shows us is the outbreaks adjusted for when they started. And this particular one shows Minnesota compared to the other American states. So you can see there are other states that are doing worse than we are and a few that are doing better. So I look to this as a sign of encouragement that it's going to get worse, but at least it seems that in Minnesota, the number of new cases is slowing. Can we go to the next one, please? I can't see the next one. There we go. All right. So what happened at the board level is that we had a teleconference call back on March 20th as the executive orders were starting to come to the governor's office. And the purpose of our call was to discuss what was happening and the emergency order, which does at that point in time, maybe not affect the practice of veterinary medicine and its regulation. So we assumed it did and made the following decisions. And I'm using the royal we here, not really, it's the board, and I'm just relaying their opinions. The decision was made to support some changes that we felt we could legally do, and greatly encourage everybody to follow the intent of the orders. And so certainly social distancing was deemed very critical, as it has been in many other venues and certainly emphasized in Dr. Ireland's presentation. But the board felt pretty strongly that in reality, if veterinarians were expected to stick to the interpretation of a VCPR requiring examination of the patient or timely visits to the premises within that 12-month period, that we could support the veterinarians and the animals by extending that to 18 months for the duration of the emergency. And so that would reduce some of the necessary visits to come into a veterinary hospital to do things like continue medication. We also discussed the VCPR in the context of telemedicine, and the 18-month guideline was clearly intended for that VCPR as well. The board was pretty clear that telemedicine is not within our regulations for establishing new VCPRs without an examination of the patient. And I know that's somewhat controversial, particularly using the analogy with the human medicine, but the animal patients don't talk, so we don't have as much health information as our human counterparts. The other decision that was made at this teleconference was to allow extensions for continuing education for veterinarians that would renew their license in 2021, so long as it was requested at the time of renewal. Some of you may be aware that when you renew your license, you attest that you have 40 credits of continuing education. If you don't, you answer the question no and just ask for an extension. So it'll be the same process, you just have longer time to get your missing CE done. So then after that came out, we began having these series of executive orders. And so the one that first really needed board discussion was 2009, which mandated a delay in elective surgeries and procedures that use personal protective equipment. And veterinarians were not specifically mentioned in that order. So then work went on behind the scenes from multiple directions, including the MVMA, to get that clarified. So then we had Executive Order 16 and 17 that came out, and Executive Order 2016 was the one that required an inventory of personal protective equipment by veterinarians via a website. And then 2017 was the one that we had been hoping for, that affirmed that the veterinarians are essential, and that the earlier order about elective procedures and surgeries applied to veterinarians. This was followed by the Executive Order 2020, which is the stay-at-home order, which singled out veterinarians as essential workers. Can we go to the next one, please?
Okay, I advanced it for you.
Okay, it's not advanced on my screen yet, but that's okay. So in addition to the governor's orders, we also have a number of orders coming down from the federal government. So let me hope my slide changes. Nikki, mine still hasn't, sorry. We have the Department of Homeland Security, I think is my next one. And they
guidance
have
on essential critical infrastructure workforce.
Yeah, that one was actually included in the governor's order 2020. So it is part of what the governor wants us to do. And the particular piece that I feel is important and the board feels is important for veterinarians is that it discusses what the guidelines are for essential critical infrastructure workforce people. And so that's us, the veterinarians. And what the two big points for me looking at this are, one, that we're supposed to be following CDC guidelines as essential workers, and two, the workers should be encouraged to work remotely. That's why you're suffering my home internet. And then in-person, non-mandatory activities should be delayed until the resumption of normal operation. So I hope that we can all take to heart the non-mandatory activities as we go forward. We do the next slide, please.
Sure. The next slide is Minnesota Department of Public Safety, Homeland Security, and Emergency Management.
This is a part that some of you may not have yet paid much attention to or were aware of, but if you had the opportunity to listen to Governor Walz's newscast at 2 o'clock on most days, the Department of Public Safety's Homeland Security and Emergency Management Group usually gets to speak up to what they're doing, mostly focused on trying to get ventilators and a number of the other essential supplies distributed around the state and finding alternative locations to hospitalize people. But on the Homeland Security Emergency Management website, they list a summary of the permissible activities, and health and safety activities such as obtaining emergency services or medical supplies is permissible. But notice the intent or the tone, emergency services or medical supplies. Okay, so they really, in my opinion, and the board's opinion, are suggesting you stay home except for these particularly urgent needs. Can we go to the next one, Nikki? The other piece that I think it's important for veterinarians to know is that this is the government branch that is charged with enforcing the stay at home. Okay. And so they've set up a mechanism wherein the public can contact their group and inform them of businesses or persons they feel are disregarding the order. And so they have a hotline and an email. So on their website today, they've had 500 suspected violation reports that have been received via the hotline or the email. And that means that people are worried, people are calling in, and you could argue that maybe some of the contacts the board has had are of a similar nature, but obviously nowhere near as egregious. Can we go to the next one, please? I'm still seeing the one we just did, Nikki.
Okay, yep, it is up, direction to law enforcement officers.
Okay, so on the same website, they have written or made a directive for the law enforcement, which I think is important for us to know as well, which essentially says, you know, if you get a report, treat it like a loud party or disturbance of the peace. So approach the business, the parties, and try to educate them on why they should not be violating the order. And then, however, if this continues, the law enforcement officers are directed to do something when they have more than 2 violations or refusals to comply. And at that point, when the misdemeanor piece would come in. So that's what the enforcement side of the order is telling the police officers. Next, please. So the board provided an update on March 27th after the Executive Order 2020 came out, strongly supporting the order and strongly encouraging veterinarians to maintain the social distancing requirements and limit what you're taking appointments for to those that are essential. And this has been the big sticking point because there are so many shades of gray. I think we can all agree as a profession that nail trims are not essential mandatory activities that can't be postponed, with a few exceptions. The part that I believe it was also provoking a lot of discussion was the board's opinion that spays and neuters were elective surgeries and should be postponed. The majority of spays and neuters should be postponed. I think we can all understand is something that could be postponed. The pyometras, the problems that can arise if you have a pregnant animal and can't for some reason have her kittens, those sort of situations are different. But the everyday spay and neuters, the board felt strongly could be postponed. This is sort of put everybody in between the rock and the hard place, and that's part of what we as veterinarians need to. Okay, Nicole, which slide are you on right now?
EO 2020 potential misdemeanor.
Okay. So this again is part of the order for 2020. And it refers several times to veterinarians, but the most important one for me is that GG that says workers in this category are subject to the restrictions on elective surgeries and procedures as set forth in the earlier orders. That reinforces that we are supposed to postpone elective surgeries. Okay, let's go to the next one. Living this advice is really hard. You should be seeing the slide of the ram on the rock. Is that where you're at, Nicole?
Yes, it is.
So I understand. I've got unemployed sons and a husband with very few appointments, that it's really, really difficult for everyone. We've got the public health issue. We've got to keep our staff safe. And then we also have the concern that we could become ill and at the same time look after our patients. So it's not easy at all. Next slide, please. So I don't want veterinarians to expect the board to say, do this, don't do that, do this, don't do that, because in every situation it's different. There's always much more to an individual patient than a simple list could possibly address. But I really like this AVMA flow chart, which is available at AVMA. We also have the link on the board's webpage, and it really is just a nice flow chart that helps you with the decision making. I would encourage everyone, if there's a gray zone appearing in your mind about a patient, this is a good way to go through and help guide those decisions. Next slide. So the main emphasis, I hope, that will come out of this is that the board wants you to use your professional judgment to decide what to do or not to do. Obviously, minimizing the exposure to the veterinarians and the veterinary staff is a primary responsibility of the veterinarian. But we also have to take to heart the need to minimize exposure to clients who are under an order to stay at home. We have to implement the CDC's directions for social distancing and also determine what can be postponed with an acceptable risk. One of the pieces that I don't hear coming out very often in the conversations with my colleagues is remembering that they're asymptomatic shedders. So the line that, oh, I don't think there's a danger because they aren't visibly ill. Remember that viruses shed before illness and can shed without illness. And also remember that the virus can survive on animals as well as other surfaces. So it's not black and white. You're not going to get the virus if you're careful. But we really, really have to make those case-by-case decisions. When you're in that decision-making process and you feel that maybe you should, maybe you shouldn't, that's the time, if you decide to go ahead, just please put a note in the medical record saying, this spay is necessary because, pyometra or whatever. I'm exaggerating, but just something so if something ever came to pass, you could go back and say, oh, this is what we were thinking, and it's probably absolutely fine. Next slide. One of the other areas that's been controversial is the personal protective equipment. I'm glad, as is all of the staff on the board, that veterinarians are embracing using reusable gowns, masks, and caps for their essential surgeries. Latex gloves, as you are probably aware, are not used in human medicine because of the latex allergies. I guess veterinarians don't get allergic to them, but they're not in shortage yet. So what has happened, and a little bit of a cause for concern, is that veterinarians have assumed that if they don't use expendable supplies other than latex gloves, it's okay to go ahead with any kind of surgery. And that really is not what is implied by the orders. So if you go ahead with an unnecessary or non-essential surgery, you're potentially endangering your staff as well as the little granny who owns the pet. This is today's headline, the Star Tribune, and I want you to note that gloves, masks, and ventilators are near gone. So in conversation with Dr. Sheftel at the Minnesota Department of Health, she affirmed that the human health side does not want the latex gloves, but that was several days ago. And so I still wonder whether or not they are going to need them if the pandemic continues at its current rate of acceleration. Next, please. So how can the Board of Veterinary Medicine take any action versus guidance? Well, if the board were to receive a complaint and it was credible, the board does have oversight of professional conduct. And there is one piece in the rules of the Board of Veterinary Medicine which says that engaging in conduct likely to deceive, defraud, or harm the public is unprofessional conduct. So if the board did initiate an investigation, it would most likely be under that authority. Next slide, please. So what is the board planning to do if non-compliance is brought to the board's attention? Well, so far, the protocol has been to informally contact the practice or individual whose behavior or decision-making has been questioned. And in those conversations or email exchanges, encourage the individual to follow the CDC guidelines and the great guidelines from the Minnesota Department of Health. We also at the board have enlisted the help of the Minnesota Department of Health to help with education on the social distancing procedures. That staff is working incredibly long hours on the public health side, but are still so graciously willing to help us with some of the practices that might not quite get it. I really don't think we have that many evil ducks out there, but there may be a few. And then the other part of the plan is to follow up. So if someone whom we contact sounds like they're planning to or already are doing most things right, then if there were to be another contact from an outside party saying things weren't going quite well, then we would follow up. So there's no big stick chasing you around at this point. We're trying to guide you and help educate you and hope that we never have to enact the unprofessional conduct. So can we go to the next one? What kind of communications coming into the board? Mostly they're questions about using your judgment to decide what's essential or non-essential. We also have been getting contacts about veterinary practices that are continuing non-essential services, and that can be particularly problematic when there are multiple veterinary practices in a town and one's doing all appointments as usual, and then two are practicing good, safe social distancing and making a decision on what's non-essential. So my hope is that everyone can follow similar thought patterns and come up with essential services and postpone those that they can. Telemedicine for new clients, there have been a couple of contacts about that. Remember that you need a VCPR to do telemedicine, which you would not have with a new client. So if somebody seeks your advice and you need to provide it by telemedicine, then it needs to be in generalities and not patient. We've also had contacts from employees that are concerned because the practice is not maintaining the social distancing requirements. So this is an inside concern versus an outside. And we've had the angry public members that are upset because they can't get their usual appointment. So that's sort of the gamut of what's been coming in. So at this point, I would love to answer questions. So Nicole, if you can let me know what the questions are. Thank you.
Sure, let me just look through all the private messages I've got to see if I'm looking to see what I've gotten. Okay. All right, right now I currently, here we go. Do we have any sort of a timeline on when we may be able to start performing spays and neuters again?
That's such a great question. I wish I know. So much depends on where the pandemic goes at this point. I think when we have a little better handle on how many more people are going to become affected, where the tipping point is on cost benefit ratio, but my guess it's going to be, and this is totally a guess, not based on good science, is that it's probably going to be at the earliest in May. But I think the government officials are working on that furiously, and Governor Walz does a very good job in his newscasts and trying to give you an anticipated update. But as he repeatedly says, the model keeps changing. There's so many unknowns.
In follow-up, has the board addressed the issue of female dogs being spayed prior to first heat cycle as is recommended?
No, the board hasn't.
Another question is, once a puppy series of vaccinations has started and boosters are needed within a specific time frame, are we allowed to perform those?
Well, you're allowed to do anything. The question is, should you? Um, and so, again, that's sort of the seesaw of decision making based on risk. So the board is choosing to not go down and say yes, no. So I wish I could give you a quick yes, no, but I can't.
Okay, we had a very similar question, so I'm going to guess your answer might be the same, but just in case it's not, they were asking for guidance on general consensus about core vaccinations such as rabies. Is it considered essential?
Well, let's sort of look at it from another perspective. As you're weighing the risks and benefits, rabies is a fatal zoonotic disease. And there are reasonable arguments for why that should not be postponed. If that is the way your professional judgment is going, that would be just an easy thing to make a note in your medical record.
Great. Yeah, important to make those notes.
Yes, please.
Currently not seeing, do we have any other questions out there for Dr. Wilson? I'm sure we do. I'll give them just a moment to type. At this point in time, I'm not seeing any additional questions. Dr. Wilson, do you have any other comments that you'd like to provide to the online attendees?
Yeah, I would. I think as a whole, that the veterinarians in Minnesota have embraced the orders. The ones I talked to, the vast majority are small animal practices, and they are doing their very best to maintain those essential services using the curbside drop-off and limiting the number of people that have contact with either the owner or the animal. So I applaud you. This is really a tough time, and we'll get through it, but the world, as they say, is going to be very different. Please feel free to send an email. If you call the office, it's going to go to voicemail, and then we will call you back based on the voice message that you leave. And don't mind answering the phone or questions, please. If in doubt, contact the board. Thank you.
We do have a couple other questions that came
Oh,
in while
good.
you were talking. What about dentistry with possible extractions?
If a veterinarian thinks that the animal needs more than just a general prophy, there might be reason in your professional judgment to justify it, but it's a case-by-case decision.
And can non-essential appointments be booked once the stay at home is lifted?
I think they could be. I don't know if the governor will give us some form of clarification. Dr. Boyle texted me a question that's a little bit unrelated, but I thought I'd mention it in case we have some students on the line or listening in. One of the requirements for a license application is a criminal background check, and that's required of many professions, but certainly all the health licensing professions. Nobody seems to be able to get fingerprints because the law offices for that non-essential purpose are closed. So we've just had another executive order and discussion with the Health Licensing Board's criminal background check program. And we have a plan B, which is that the criminal background check, instead of being done on fingerprints, will be done on name and date of birth searches. But after the emergency is lifted, those individuals that have been licensed based on just the name and date of birth will have to go back and do their fingerprints. So we don't expect a delay in licensing other than the fact that it may take a little bit longer to do the simplified search because there may be many John Smiths to check on.
Okay, couple other questions. What if a client wants to come in for diagnostic test only?
It would depend on the circumstance. If it's just for a quick blood draw, I don't know. I mean, if it's going to be something that shouldn't be medically postponed, that would make sense. But if it's for some other purpose that can wait, I think it should wait. That would make it non-essential. That's where that AVMA flow chart helps.
Great. I think someone provided an example here as phenobarbital levels for T, for example. I'm just reading what they wrote. So,
if they're trying to adjust phenobarb levels and seizures, that would be something that you could justify as being essential.
okay, great. Going back to the spay-neuter question, what about if there's a situation where there's two young dogs, one male and one female in the house? Can you spay or neuter one of the animals?
Again, that would be something you'd have to look at the individual circumstances. If the owners ideally would keep them apart.
In an ideal world, right? Okay, I am not seeing any other questions at this point in time. So I do want to thank Dr. Wilson for joining us. And